Hi, this is Dr. Laura Tigler. Welcome to my channel. This YouTube channel is meant for giving you good medical information. It is not meant to give you specific medical advice. So please do see your primary care provider, your primary care doctor for specific medical advice tailored for your needs. At the end of providing you with medical information, I will give you some spiritual information. If you do not want to stay for that portion of the video, I will let you know once the medical portion is finished, and then you can simply click away. And lastly, please like and subscribe. Okay, so today we're talking about heart failure. Similar to my prior video series on chronic kidney disease, heart failure is not so well named. So heart is obviously perfect, heart failure. The organ involved is the heart. Failure has somewhat of a negative connotation. It's also confusing for the patients. Failure, well, my heart's working and then it failed, but obviously my heart didn't fail. I'm alive. So it has kind of like a black and white type of connotation. And then the patients, it's hard for them to wrap their mind around that. It takes a while to understand and grasp that they even have heart failure. But basically, failure really means weakness. So it's just not pumping the blood in its usual strong way. So sorry, but that's what we called it. Okay. So you might have symptoms of heart failure for a long time before it's diagnosed, because it's not a disease where, let's say, you have a sore throat and then you get nose congestion and you realize finally all your symptoms are there and you realize you have a cold or some virus, and then you treat it and it goes away within just a few days or 7 to 10 days. So it's not like that. This is a chronic condition, and that's what this YouTube channel is for. I'm trying to teach you about chronic conditions. I'm a doctor and I do treat patients age 65 and older, and primarily I take care of chronic conditions. So we talked about chronic kidney disease in previous videos, and now we're going to do heart failure. So now you know that heart failure simply means that your heart, which is a pump, is not effectively pumping your blood. Obviously, there could be a lot of reasons for that. That's just common sense, and there are a lot of reasons for that. But the primary cause is coronary artery disease. And that means that the arteries that feed your heart, so your heart is big enough, it can't get the oxygen and nutrients it needs from the blood that's passing through it, through its chambers. It has to have its own source of nutrients and oxygen. So the heart muscle has little tiny arteries that feed it, that provide nutrients and oxygen. And if those little vessels, coronary just means heart, if those vessels are blocked, then if they're blocked enough, they're completely blocked, let's say, then the muscle distal to that little tiny artery will die, and that's a heart attack. Or it could be that just over time, relatively, there's enough blockage in the artery that it's just not getting quite enough, but just enough. So you could have heart failure from either having had a heart attack, because the muscle is just dead in that portion, and it's obviously not going to act as an efficient pump in that portion of the organ. Or you could get heart failure from coronary artery disease just because there's been a relative lack of oxygen. There could be other reasons why you have heart failure. The heart muscle itself might have a condition called cardiomyopathy, and there are a lot of different types of cardiomyopathy. It just means disease of the heart muscle. It could be that you got a virus. I'm talking about a virus again, but it could be that you got a virus and then the virus did cause other symptoms, but it also affected your heart, and your heart couldn't recover from that. So the heart muscle is either thin and floppy or thick and stiff. It could be that you were born with a defect to the muscle of your heart. There's various types of cardiomyopathy. A third cause of heart failure, because the first I mentioned was heart disease, coronary artery disease, or blockage in the arteries that feed the heart. The second I mentioned was cardiomyopathy, which is disease of the heart muscle itself. And then the third common cause is elevated blood pressure. That's hypertension. And I will talk about hypertension in a separate video series. And then the valves of your heart could be stiff or have other problems. So in a previous video, I mentioned how, like, say the cholesterol glob or molecule going through your blood might join up with a calcium, and then that kind of gunk or slime with the mineral in it, calcium, might stick up against the arterial wall. And just imagine if there's enough of that where the arterial wall has all this gunk and calcium, and it goes through the pipe, the blood vessel, and if we take an x-ray, we can actually see evidence of a cylindrical pipe, in your cardiovascular system. And we're not supposed to be able to see your artery on an x-ray, but we are able to because of the calcium. So if calcium can be on your arteries, on the wall of your arteries, then calcium can land on other places of your body, and that can include a valve in your heart. So there's 4 chambers in the heart, and a valve kind of opens and closes, and if there's calcium on it or other minerals or gunk on it, it can't quite open. It's stiff, and that's impeding the flow. And that's just another reason why your heart might not be able to pump effectively. It might be pumping less blood each time it has a beat. So heart valve problems can cause heart failure. And sometimes we are able to surgically correct that. Another cause of heart failure that we can correct is high blood pressure. So it is possible to have almost curative treatment for heart failure, but generally speaking, it's not able to be cured. But with high blood pressure and valve problems, there is a lot of hope with that. Arrhythmias. So you might have a heart rate, say 105, which is abnormal. That's too high. But it's not affecting you. You're doing fine. There could be various reasons why when you're sitting and resting. Here, let me open this a little bit there. I have the fan going. When you're sitting and resting, your heart rate should be between 60 and 100. But maybe when you're sitting and resting and we measure your heart rate, it's always at 101 or 105. And there's various reasons for that. You could have anxiety. There could be an underlying problem with the heart. There could be other reasons. But if your heart rate is just a bit too high on a chronic basis, even a few beats, that alone could cause heart failure. So when we doctors check your vital signs, they are vital. I really do use your vital signs to help determine what conditions you might have. And especially if I see you over time, I have a lot of data that I can analyze. And let's say I see you, and usually when you're getting your heart rate checked by the medical assistant, it's in the 70s. And then I see you one day and it's in the 90s. And the patient might say something like, oh, I just was in bad traffic. Or they might give some reason why they think it might be high. And it could be that. And then let's say the next time I see them, it's 100. And then maybe it's 101. And then maybe next time it's 70 again. But over time, let's say the patient has no symptoms other than just that vital sign. That's giving me a clue that I have to dive in there and check the patient's heart. So arrhythmias can contribute to heart failure. Obviously, I just told you about simple tachycardia being the word that we use for elevated heart rate. But there are many types of fast heart rate. Atrial fibrillation is a type, ventricular fibrillation, which is a rhythm that if we get that rhythm, that's going to cause us to have cardiac arrest. The heart is going to stop. and there's just a bunch of arrhythmias in between the very simple tachycardia and the ventricular fibrillation. That could be another video series. Okay, and then using toxic substances could cause heart failure. And the first thing most of us are thinking is, well, I don't use toxic substances. But most of us do drink alcohol, and that is a toxic substance. I'm so sorry. So we finally have conclusive data that the only safe amount of alcohol to drink is 0 amount. So the teetotalers were correct. I'm not saying we have to have prohibition, but the teetotalers were correct. So if you are going to have alcohol, please do so in moderation. Rare to occasional use of it, and then just a little bit. Other drug use, it could be cocaine or other drug use, can definitely hurt the heart. And there can be another cause for heart failure, and that's congenital heart defects. Another separate cause for heart failure is diabetes. Diabetes mellitus type 2, diabetes mellitus type 1. And certain thyroid conditions can contribute to heart failure. So I wanted to tell you about the symptoms of heart failure. As I said earlier, you could have heart failure and not know it because the symptoms aren't very specific. And then you might not tell your doctor, or it might take a while to get an appointment. And just as an aside, if you have a relationship with a primary care provider like me, and if you do get symptoms, I'm going to list them in a moment, it's okay to call your provider's office in between appointments and just say, oh, hey, doc, just let the doc know that I have this going on, and ask them what they want to do about it. Because sometimes that's going to help us initiate an investigation, diagnostic studies, and a treatment that could help prevent you going into the hospital or even help prevent death. So please do contact your primary care provider in between appointments. Don't wait for the next appointment. You can call the nurse line, you can call your 800 insurance line, whatever you're comfortable with, but I do recommend you call the primary care provider's office. Okay, here's a list of the symptoms. Shortness of breath during activity, like walking to the mailbox, walking your dog. Shortness of breath when laying down. So you're flat, but then you sit up. I can breathe now. So lying down and shortness of breath could tell you that your heart is weak. There's some fluid backing up in your lungs. And then when you sit up, that's resolved a bit, and you can exchange oxygen and carbon dioxide well again. Lack of appetite. That's very nonspecific. You could have a lack of appetite when you're kind of depressed, kidney disease, other conditions, but that's nonspecific. So do watch yourself and don't just assume it's something that's not important. Waking up in the middle of the night, suddenly breathless. General tiredness, general weakness, swelling of the legs, feet, and ankles. Remember I told you in a previous video that there are 3 organs that I think of when we have swelling in our feet and ankles: heart, liver, and kidneys. And then swelling in your ankles could be due to peripheral reasons, like a venous insufficiency or problem with your veins. But of course, if you have swelling in your ankles, and of course I treat the elderly, I'm going to worry about the heart, liver, and kidneys. Swelling of the abdomen. So a lot of people don't realize this, but when you have backlog of fluid, it could be building up in your chest, in your lungs. It could be building up in your feet, but it can also build up in your tummy. So you got to pay attention to that. Like sometimes I'll have patients will say, my tummy just feels bigger, and the women might say, feel like when I was pregnant. So pay attention to your body and trust your body. Rapid or irregular heartbeat might be a symptom of heart failure. So I told you that could cause heart failure, but it also might be a symptom of heart failure. Like you might feel palpitations or, oh, my heart just skipped a beat. You're not supposed to be aware of your heartbeat, you know. And then rapid weight gain, and that goes with the swelling. But remember, you might not have swelling in your legs. You might have it in your belly, or it might be in your heart, and you don't really know. That's where the word congestive comes from. It just means your body is full, congested with a backlog of fluid or water. So you might gain weight fast because the water is pooling in your body, and that's the water weighs something. You might have a chronic cough or wheezing. So yeah, you would think respiratory, right? Oh, it could be my sinuses or my allergies or my lungs. But it could be your heart too. So please do call your doctor. And nausea, that's another possible symptom. So now let's get to the treatment. Okay, so I told you that controlling blood pressure might be helpful. Maybe a surgical procedure or intervention for your valves. But primarily, the treatment for heart failure is lifestyle changes, but then medications. Oh, and before that, let me tell you about how to diagnose it. So we doctors can hear your history. We can do a physical exam. So history and physical exam is contributory towards diagnosis for sure. Everything I just previously mentioned. But then we do have blood tests, radiograph imaging such as x-ray of the chest, and we have nuclear testing. I know that sounds way out there. Ultrasound. So let me explain them a bit. So a blood test called BNP, Boy, Nancy, Peter, if over 100, might indicate that you have heart failure or an exacerbation of heart failure. When I have patients who have been to the hospital and we've diagnosed them with heart failure, say for the first time, and I see them in the post-hospital visit, I'm looking at the hospital records and their BNP might be 4,000 something. It could be that high. Or a person could have, that was an exacerbation of their heart failure, but they could have chronic heart failure without an exacerbation. They're just kind of steadily moving right along with some symptoms, but not an explosion of symptoms. And then at that point, their BNP might be 200 or 300. So that blood test is helpful. And then a chest x-ray is helpful because we can see how big your heart is. We can see if there's fluid in the lungs. And EKG is helpful, but it's just a basic 60-second, 1-minute test. It's just measuring the electricity that your heart is generating, but it does tell us certain things about the chambers and if there's stress to the muscle. Echocardiogram is basically an ultrasound of the heart. Echo, sound, wave, sound, echo, echo, echo. Cardio means heart, and gram is picture. So it's just a picture of your heart with an ultrasound imaging. And that's diagnostic of heart failure. We'll find out how much blood your ventricle is pumping out per beat, what percentage of blood is coming out that can come out per beat. And we call that the ejection fraction. So when we squeeze our left ventricle, we're pushing blood out. That's ejecting the blood. Okay, and then fraction is what percentage, what's the ratio of the blood coming out compared to the capacity that could come out. So ejection fraction is a phrase that patients do hear a lot. Half the time it could be low, half the time it could be what we call preserved. So you can have heart failure with a normal ejection fraction. It's just that that's one way to measure and objectively delineate problems with the heart. A Holter monitor is can be placed or given to the patient, and we can measure the heart, say 48 hours or 2 weeks. We're looking for arrhythmias and other problems, and obviously that's because certain arrhythmias can cause heart failure. A stress test is like an EKG. An EKG is when you're resting. So you're laying down on the table and we put electrodes on your body and we're measuring the electricity that your heart's generating. It's just a very passive test. But a stress test is an EKG. It's just that it's running constantly, and then we're stressing we're stressing your heart at the same time. We can do that by making you walk on a treadmill, or we can do that by injecting medication into you. But either way, it's very similar to an EKG in the office. It's just that we're making your heart work harder. When we do that, we can sometimes find problems with the heart. The last one is a radionuclide ventriculography, and that's where we actually inject some radioactive material and take a picture after that. You won't make the airport screening light up, I don't think. um, okay, that's a joke. All right, so can heart failure be prevented? Just to remind you, smoking is bad for the heart, so please quit smoking. Please don't be around anyone who's smoking. Maintain an ideal body weight because obesity is going to be a contributory factor towards difficulty for your heart to pump properly. Exercise regularly. Walking is ideal. Eat a healthy diet. That's a low salt diet, a lot of fruits and vegetables, especially vegetables, green leafy vegetables. Low salt, you probably all know this, 1 to 2 grams per day of salt. Limit the alcohol, but I would say no alcohol if at all possible. And limit the sodium, of course, which is what we were just talking about. Medications. So ACE inhibitors are like lisinopril. ARBs are like valsartan. Diuretics are like furosemide. Beta blockers are like Coreg or carvedilol. Digoxin that's what we call it, also called digitalis. And they help, the ACE inhibitors help by lowering the blood pressure and improving blood flow. The diuretics can take water off your system, but they can also hurt the kidneys. So all of this has to be done with a doctor's supervision. Beta blockers can slow a rapid heartbeat, and they can lower blood pressure, which is important. The digoxin can help the heart pump better by strengthening the muscle contraction of the heart, and it's only appropriate with certain types of heart failure. And then there's also Entresto, which is what we consider a pillar of heart failure treatment, and that includes sacubitril, sorry, and then valsartan. They're combined together. Then there's spironolactone, that's another class, MRA class, and that can help with, it's a bit of a diuretic and also lower blood pressure. Beta blockers we already talked about. And then the SGLTs, we talked about that in the previous chronic kidney disease video series. I did write an article about those. It's in the link in my YouTube channel. And that has been proven to reduce hospitalizations and reduce cardiovascular death. So we do have wonderful medications for heart failure now. We can improve your quality of life, help you stay out of the hospital, and reduce your risk of premature death from heart failure. Okay, so that ends the medical information for this video. I'm going to give a bit of spiritual information. This is the time to click away if you don't want to hear the spiritual information. But before you click away, please like and subscribe. Okay, so as I've mentioned in other videos, I am a devout Christian. I am not trying to proselytize or turn you into anything. It's just that through the many years of my practice, I have found that people who have a spiritual discipline, a faith, even close family tie, something that is very meaningful to them, something greater than themselves, those patients tend to do better. They tend to have better outcomes. So I'm going to include a prayer at the end of this video. It's in the book that I wrote called You're Saved, and I will show that to you. So this is the book, and you can buy it on Amazon. I am a military spouse, as it says. I'm the doctor and military spouse that wrote the book. My name is Laura Tigler. Dear God, thank you for providing for me. I know that your sustenance is what really gives me life, and that everything here in this world ultimately comes from you. It is not about what I think I need, but what you know I need. Let me always remember the lesson that you taught me. No matter what, you will provide. Amen. Okay, see you next time.